I think we're good. Yep, there we are. We're on. We're ready to go.
Okay, so I'm just going to go ahead and jump in here, guys. I'd like to welcome you all to tonight's webinar, Mommy, My Ear Hurts. My name is Dr. Abby Ballard of Ballard Family Chiropractic in Effingham, Illinois. I am the host for this evening's program. You're about to meet, or hopefully you can see a little box up in the corner. That's Dr. Stephanie Barto of Bartow Family Chiropractic. She's all the way out in Pittsburgh, Pennsylvania. And the two of us are coming together tonight to talk about a topic or a condition, I guess you should say, or we could say, that comes into our office all the time. So Stephanie and I were actually classmates in chiropractic school, and now we are both certified pediatric chiropractors for our communities. So that means that we don't just see kids, but we specialize in the care of children and their common childhood issues, like ear infections. So I actually had two little children today, a 1-year-old and a, I think, 14-month-old, both who are in because of chronic ear infections. And in fact, my 1-year-old that came in today, just started care today, was on his 3rd round of antibiotics. And this is his mom's lost count of how many ear infections he's had, but is now to the point where amoxicillin doesn't work, and now Cipro doesn't work, and he's treated with Augmentin. But they try it every time. They try the amoxicillin first, and then the Cipro, and now on Augmentin. So this kid's had more antibiotics than anybody can actually, recall. But this is the thing that Dr. Barto and I would like to see stop. We know that there are solutions for parents that are out there and looking for other options for their kids. So I won't take up a whole lot more time tonight, but I just want you guys to know, Dr. Stephanie is the bee's knees. This is a topic that she loves to talk about. She's highly informed about, and most importantly, she sees results in her office. So Dr. Stephanie, I'll let you take it away.
Thank you, Dr. Abby. So we're going to make sure you can tell me, Abby, to make sure that I'm trying to share the screen with the Prezi. Can you see it?
Yep, we're up and running.
Okay, perfect. Okay. So as Dr. Ballard said, I am Dr. Barto with Bartow Family Chiropractic, and I want to thank you guys for tuning in. This is
Oh, Stephanie, you froze. I don't know if you can hear me.
So before we dive into it too much, I want to tell you a little bit. Both Abby and I have very unique practices. I'm the owner of Bartow Family Chiropractic. She is Ballard Family Chiropractic, where we specialize in kids and family wellness. Both of us have had many, many, many hours of continuing education, specifically geared towards pregnant women and kids. This pertains to me, not so much Dr. Ballard, but I personally have been married to Drew for 9 years, and I have just 3 kiddos, a son, Xavier, and a daughter, Autumn, and a new infant, Charlotte, who is she's with me below the screen. So hopefully she's sleeping now and continues to sleep for the next time being. But I know that you guys aren't here for me. You want to get some information, so let's dive right into it. Now, throughout this whole thing, what I want you to keep in mind is that what we're talking about is really, truly more than just an ear infection, okay? There's really something more that's going on with these kiddos than just an ear infection. And yeah, they might grow out of an ear infection, but what we generally see is they grow out of an ear infection and they grow into something else. And that's really what we need to uncover. We need to get to the bottom of this so that we're not dealing with one health problem after another. What I'm going to go through with you tonight, it is not my opinion at all. It is just the facts. I take my role as a doctor very seriously. My job is to teach you. I'm here to give you information, and I know without a doubt this information can absolutely change your child's life. One last note before we move into the content. Patient education is very important to my practice and to Dr. Ballard's practice at all. So next month, well, it's actually just in 2 weeks, we're going to present the perfect storm. We're going to look at the cause behind neurodevelopmental disorders. That'll be on Wednesday, November 1st. So take be on the watch out for that and register so that you don't miss that content. So here we go. Why my child? So before we go about it, we're going to go over some statistics. Now, in 2006, over 9 million kids got an ear infection, 8 million of them of which got a prescription. The reality is that 85% of kids will have at least one ear infection before they're 3 years old. So it's very, very common to be experiencing. This ultimately results in a lot of medical expenses, a third of which is completely paid out of pocket. So insurance isn't even that helpful. So this is actually the most common reason that kids go to the ER, which makes it a very common reason that parents miss work. And the most common treatment for ear infections is antibiotics. And if you've heard anything about antibiotic resistance bacteria, this is one of the leading contributors to that. Now, these aren't my stats. I didn't make any of this up. But when you look at these statistics and you hear that in the news that they're saying that we're abusing or we're overusing antibiotics, how could we, if antibiotics actually worked, if they were actually fixing the problem? What we generally find is a lot of parents will go to the medical doctor because their kid has an ear infection or an earache, and they're just looking for answers. But what generally happens is they leave with an antibiotic in hand. Now, when we look a little bit further, most parents will, when it comes to their children, they'll adhere to the antibiotic recommendations, meaning they take the entire full course. But if that's the case, then why do these ear infections keep recurring? Is it possible that maybe we're missing something here? So there's some misconceptions that happen. Oh, I just something here. I gotta mute myself. So there's some misconceptions. The first is that ear infections are normal. They absolutely are not normal. They're extremely common, but they're not normal. I have, for my kids, one of mine has ever had an ear infection. So it's not something that all kids experience. They also blame horizontal ear canals. This isn't the truth either. This isn't the reality, because all kids aren't getting ear infections and all kids might have the same horizontal ear canals. We also consider that ear infections are bacterial, but 1 in 16 actually are not bacterial. The way they're diagnosing ear infections is they're just looking for a fluid buildup, redness, and irritation. That doesn't mean there's actually an infection happening, and it certainly doesn't mean that the infection would be bacterial. But even if there were an infection in this buildup of fluid in the ears, only about 15 out of 16 are viral, not bacterial, so an antibiotic isn't going to do anything for it. So some things to think about with antibiotics. It's estimated that antibiotics help about 1 in 16 kids that they're prescribed to for ear infections. Common side effects of these antibiotics are rash, abdominal pain, diarrhea, nausea, fever. These things kind of sound like the common cold. So parents don't actually usually think that their child's having a side effect to these antibiotics. Additionally, antibiotics kill life indiscriminately. They don't consider the difference between a probiotic, which is a beneficial bacteria, or a harmful bacteria. So what happens if we're giving our children antibiotics before the age of 1, we actually see that these children are 3 times more likely to experience allergies, 4 times more likely to develop asthma, and 6 times as likely to develop eczema. So they're trading off some of these short-term things for some pretty big chronic conditions. A 2007 study from the American Academy of Pediatrics, they, based on this study, they changed their guidelines to one of like giving an antibiotic for every ear infection, and instead telling their pediatricians that they should go through a period of time of watchful waiting. A survey based on this found that 85% of pediatricians agreed with this, that yep, rather than hand out an antibiotic, we should just do some watchful waiting to see what happens. Maybe this will clear up on its own. However, 3 years later, they surveyed the pediatricians again, and they found that only 15% of them are actually following the new guidelines, which begs the question is, they weren't supposed to, first do no harm, but rather than watching and waiting to see what happens, we're handing out antibiotics that have some side effects to them. Now, I should add in a disclaimer here. I am not anti-antibiotics. Antibiotics have saved the lives of millions of people. MDs are absolutely not bad people. They are caring people that got into profession to help people. They have a true desire to love and help kids. The issue is really that if your only tool is a hammer, then you start to see every problem as a nail, meaning they don't know what else to do for these kids. All they have to do, all they can do for a child that's, uncomfortable with an ear infection is to hand an antibiotic and hope that it gets better sooner. And if you've been a parent of a child with an ear infection, which is probably why you're on here watching tonight, you know how painful and heart-wrenching it is to see your child, be in that much pain. But the question that we're really going to talk about here tonight is that, we have, in the United States of America, we have the best doctors. We have the best hospitals. We have access to the best medications in the entire world. But what's happening is that our children are really, really sick. And in fact, they're sicker than they have ever been before. So we have to start asking ourselves, what is it that we're missing? And I believe what we're missing is getting to the real cause of the problem. Happening. And for ear infections, we can really see that there's 3 problems that happen here. There's bad plumbing. There's a neuroimmune dysfunction, and there's inflammation in the diet. Now, so we're going to go over all of those. So the very first thing that we're going to talk about is the bad plumbing. So if you take a real close look at the ear, there's actually a really tiny muscle at the very top that's called the tensor valley palatini. And this little tiny muscle, what it's supposed to do is help the fluid of the ear drain. Now, the thing with this muscle is it gets its nerve supply from the very top of the spine. And so what happens is that if we have a nerve irritation at the very top of the spine, this muscle doesn't function the way that it's supposed to, and it leads to fluid accumulation, and that's a possible infection. As you guys know, like mosquitoes, if there's stagnant water, then mosquitoes can contribute or can come about. And the same sort of thing that can happen with our ears. If we start to get this fluid accumulation, then yep, absolutely a possible infection could happen. Now, the question is, why would we have this misalignment at the very top of our spine? Well, that usually happens from the birth process. If you've had a child that has torticollis, difficulty nursing, if their head favors one side or the other, maybe colic, a poor sleeper, if they experience constipation, any of these things, they can tell you that your child might have some underlying issues going on with their spine and their nervous system. Now, the reality is nearly every child that comes into our office has an upper cervical subluxation. Because we see a lot of women all throughout their pregnancy, we get to check a lot of kids as soon as they are born before there's even issues arise. But just because of the birth process, we generally see that there's an upper cervical subluxation occurring. So one of the biggest causes for the upper cervical subluxations is a C-section. So this is a pretty graphic video. If you're wheezy or if you have little ones that happen to still be awake, you might want them to look away. But this is actually what happens during a C-section. So this is actually a vacuum-assisted C-section that they had a vacuum attached to that baby's head, suctioned them out. And because there's nothing else to hold on to, they grab the little baby by their head and they yank them out. So I find that to be a very disturbing video. Now, by all means, if there's yet 45% of kids enter the world this way in the United States. There's a very high incidence of asthma among C-sectioned babies, and one of the reasons is their lungs don't clear. If they don't go through the vaginal delivery, their lungs don't properly clear out all of that stuff. You can see that they tried to suction. They're just not quite as good as what we can do during a vaginal birth. So C-section's a really common part of children's histories with ear infections. We also see it in kids with reflux, torticollis, difficulty nursing, constipation, sleep issues. This is really a common first trauma to our children that's setting them up for some real issues in life. The next thing to talk about is their lymphatic drainage. Now you can see that the lymph is kind of like a sewage system. It drains all the crud out. And you can see that there's all these veins throughout the body, and there's a lot in the head and the neck, and the lymph nodes what they do is they kill off the crud that gets into our bodies. So what we'll do in my practice is we'll teach and encourage parents to massage down the lymph nodes of the neck. And if you have a lymph node that has an infection in it, you'll kind of feel like these little BBs, and that's the lymph nodes. Now, if there's an infection there, that's how you can feel the BBs. But if that infection stays for too long, then those lymph nodes, they can calcify. Now, this gets tied right back to birth. Like, if you've had a crick in your neck, then you're really well aware that those muscles in your neck, they'll spasm. And if you have that spasm, what happens is the lymph nodes, that drainage shuts down. Tonsils and adenoids are also part of the system. They're the first line of defense because we encounter them through eating and breathing. And we're going to talk about that in just a moment here. Okay. This here is the tube surgery. So if we've got that issue with the tensor palatini muscle and our lymph nodes aren't able to drain the fluid appropriately, then what we have available in the medical world is to put tubes in their ears, and it works by forcing the fluid down. But the question becomes, where does it go? And is it okay to have a complete barrier between the outside world and your inner ear? That's a question to ask as well. So the way it works is if you've ever had like a jug of water and you open it up, you can only get so much water out before you have to open up the hole at the top, and that allows it to drain better. So that's what's happening with these tubes. But like I said, I don't know that it really makes a whole lot of sense to open up a barrier from the outside world to the inside of your ear. In fact, not only does that not make sense, but there may not even be real any benefit to it either. Placebo group or the tube surgery group. So if you're getting tubes in your ears, you'd like to, think that I went through this because my kid's not going to get infections later on in life, but we're not actually finding that to always be the truth. So this is how the problem as we see it. Our kids get ear infections, and because antibiotics don't address an upper cervical subluxation, we get a tube surgery. That forces all of that crud to drain regardless, and it ends up in the tonsils and the adenoids where it doesn't drain anymore. So then our kids start to have problems there. So we go in and we have surgery, we take out the tonsils, the adenoids, we force everything to drain even further, and it heads down to our lungs. And the next thing that we see when our kids grow out of the ear infections, they grow into the tonsil issues, and then they grow out of that and grow into asthma, which now is affecting 1 in 10 kids. So because you can't cut our lungs out, now we hand our kids a nebulizer for life. So the second problem that we encounter is a neuroimmune dysfunction. So what's your spine? Well, your spine is a whole lot more than just muscles, tendons, and bones. Your spine's job is to house and protect your nervous system. In fact, in the very beginning of conception, we had 2 cells that united, and then they divided over 1 trillion times. That's a lot of times. That's a lot of zeros there, okay? And they did that, and they developed into a person, which is absolutely incredible that you could go from that into this little tiny being. But this is really important because at just 2.5 weeks of conception, a brain and a spinal cord developed. And that needs to happen because your brain and your spinal cord they control everything. And from there, the rest of the body is developed. So you can see if this is how it happens, if our brain develops first and then the whole rest of the body comes from it, if you have any dysfunction anywhere in your body, doesn't it make sense to check your nervous system to make sure that your nervous system is working the way that it's supposed to? Maybe. So a little bit more about the nervous system is its job is to perceive the environment around it, coordinate a behavior of all of the cells in the body. That's what your nervous system is supposed to do. So you can think of it kind of like an air traffic controller of your body. And there's really two main modes of operation. You have this gas pedal, which is your sympathetic nervous system. This one here in the sympathetic nervous system, this controls our fight or flight response to stress. This is where we go when we're scared, when you're playing sports, or let's just say you're being chased by a tiger. This means that your eyes will dilate, your blood goes from your muscles to get, or your blood goes to your muscles to get away from the lion, or to fight it. We release stress hormones from the adrenals so you can be active and strong, but it'll shut down everything that's not necessary, like your immune system, your digestive system, your endocrine system, okay? Which is fine for getting rid of a tiger because we don't need to be digesting our food or fighting a cold when we have a tiger fighting us. But the reality is this is not a good place to live our life. The other aspect of the nervous system is the brake pedal mode, or the parasympathetics. This is the side that is responsible for growth and development. Your immune system is housed here. Both sides are equally important, but this is the side that you really want to spend a lot of time, especially if you're a kid, because you have so much growth and development happening. This is where a kid needs to be. Their immune system or their nervous system needs to be more parasympathetic dominant. Okay. So what causes us to go from one side to the other are these three T's. Okay. We call them traumas, toxins, and thoughts: physical, chemical, and emotional stresses. Now, I've been hitting on a lot of physical stresses with birth trauma a lot, because with these kids, that's really the main issue that we see. But we can also include our diet for chemical stresses, but also the environment. If there's smokers in the family, any crud in the air, water, food, that all falls under toxins. Our thoughts, that's something that we don't normally think about and stress out babies. But if you think back to pregnancy, if a mom is stressed out, they're producing all kinds of stress hormones, and their babies are actually like marinating in all of those stress hormones for 9 months. So unfortunately today, pregnancy isn't as joyful because it comes with a lot of medical diagnoses, and we're all concerned about what could go wrong. In fact, if you've read What to Expect When You're Expecting, it seems as though that book may have been written by Stephen King rather than a health professional that's really excited about babies. But basically, what we see is moms are really stressed out from day one, and that stress gets translated over to baby. Now, because we cannot be in growth and protection at the same time, you're going to end up being in one or the other. There's two halves, okay? And if you're primarily in fight or flight, then the other side of growth development in that immune system and healing, it's just not happening as much. So if you have a stressed out kiddo, then they're really stuck. It's like gas pedal is on and the brakes just aren't keeping up with it. The third problem that we have is inflammation of mucus. That's not necessarily a bad thing, because that's how your body externalizes. When we sneeze, we cough, we have diarrhea, all of those symptoms that medications are there to get rid of, those symptoms don't come because there's a virus or the bacteria. They don't come from the virus or bacteria. Those symptoms are very intelligent responses from your body to help deal with the virus or the bacteria. So if we're taking medications to shut those symptoms down, then you're actually taking away your body's attempt to get rid of it. So even if mucus is a problem, it's really the biggest problem with mucus is that we have a faulty drainage system. So, and that's just like we've been talking about. So mucus is a healthy response. Mucus itself isn't really the problem, but having a bad drainage system absolutely is a problem. Now, with that being said, limiting your body's exposure to those irritants will decrease the need for your body to produce mucus. And some of the most common offenders we see for making that mucus are dairy, sugar, grains, processed foods, and smoking. Now, it's pretty easy to keep, don't smoke in your house, keep your kid away from smokers. But if you look at, dairy, sugar, grains, and processed foods, it's pretty hard to do to avoid all of those things. And what we could do, instead of just looking to see how do we remove, now without a doubt, we should minimize these things. But the reality is that if you have a problem with dairy, you have to remove dairy 100% completely. And you have to remove it for like 4 weeks to fully rid your body of it to see if dairy is a real causative problem for you. But what if, rather than just looking for all of the things that we have to continuously remove from our life, what if we could find a way to adapt to them better? Because there are lots of people, and your children, and there are lots of friends that can eat these kinds of things, and they're kind of fine. They're not having as many problems as you do. So I want you to imagine for a moment that rather than like removing every little thing that causes stress and anxiety in our life, like if we could remove the people, their jobs, political races, bad food choices, homework. If those things were gone, imagine if we just kept those things. But what if our physiology was a bit different? Like if you've met those people where like nothing seems to bother them, they are better adapting to those stresses. Or you can think of like just people who live in Alaska. If I went to Alaska, I'd be freezing cold. But the people who live in Alaska, they don't feel like it's as cold because they're adapting to it. So what I'm wondering is, what if your child could adapt to some of these stresses a little bit better, these chemical stresses a bit better? So how do you know? How do you know if your kiddo has what we're talking about? How do we find that subluxation? Well, in Dr. Ballard and I's office, what we use is called an insight subluxation station. And this shows us exactly how your nervous system is functioning, where the interference is, and its severity. So essentially we can look and see, is your nervous system under stress? And if it is under stress, then we know it is unable to adapt as appropriately as it should be. So a lot of offices, they'll do x-rays. Because I see so many kids and pregnant women in the office, it just doesn't really make a lot of sense for me to do x-rays. And while x-rays can give me a really nice picture of your spine, I actually can't even tell if you're alive or dead with an x-ray. But these scans that we do in our office, they tell us how your nervous system is functioning. And they're really simple to do. So this is a colleague of ours, and you can see he's doing a scan on a little kiddo. And it's just like it's a thermometer, and it just runs right up his back, and it tells us about the stress. That's it. It's real simple to do, but it gives us a ton of valuable information. Now, once we see that, yep, your kid does have a subluxation, there's interference and stress on his nervous system, the next question parents want to know is, how do we remove the subluxation? And we do that through a chiropractic adjustment. Now, a lot of times parents will get a little bit nervous about chiropractic adjustments. I want to assure you, when it comes to kids, there are no Jackie Chan moves or Chuck Norris. That's not what we do. The adjustments that we do are very gentle, very easy. You can see in these pictures around here, I'm adjusting a couple of newborns. But here's a video of our colleague, Dr. Dave, doing, how do I do it? Giving an adjustment. So there you got to see a little one get an adjustment. Really simple to do. Most kids really enjoy getting adjusted. They usually fight to see who gets on the table first in my office is what the biggest problem that we have. So studies have shown there's a difference between kids who get adjusted regularly and kids who see their MDs often. So in a survey of about 200 chiropractors and 200 medical doctors, they found that of the patients there, only about 20% of the medical doctor kids never had an ear infection, where in the chiro kids one, 69% of them never had an ear infection. This has definitely been my experience. Whenever I was pregnant with my first son and the midwives found out I was a chiropractor, they immediately said, oh, so you'll never have an ear infection. Wasn't totally true. We had one, but I adjusted them that night, and by the next morning, we were completely over it. No antibiotics needed, never had another issue again. Recently, a study was done on 332 kids aged 4 weeks to 5 years old who were suffering from recurrent ear infections and then started getting chiropractic care. 90% of them had no recurrence of ear infections for at least 6 months following their care, and nearly 95% had undergone pharmaceutical care unsuccessfully. So what happens is chiropractic offices tend to be the last resort. We go through, our kids get ear infections, and we get the standard care, which is a lot of antibiotics, and it doesn't help. And a lot of parents are wisening up. That's why you guys are watching this. Like, there's got to be something more going on. I'm giving these antibiotics, and they're not actually working. What else can I do? And so then kids end up in the chiropractic world, and they do great. I just had a little girl. She's the cutest little girl. She came to me, her mom called me on a Friday night, absolutely desperate. She had had an ear infection for 3 months straight, at least fluid in the ear for 3 months. And if it didn't clear, they wanted to put tubes in her ear. So I saw the mom the next morning. I saw the little girl the next morning, and we adjusted her. We did her scan, definitely had ear interference. We adjusted her. We saw her again on Sunday. We adjusted her again. And on Monday, when she had her follow-up appointment with her doctors, the fluid had miraculously disappeared in 2 days. So your ear tubes avoided. And the mom was so impressed and like just absolutely shocked by it. If you follow my Facebook page, Barto Family Chiropractic, we had just shared that video. Look for the little girl and her mom sharing that testimony. So the reality here is that chiropractors, I don't consider us to really truly be an alternative to antibiotics or an alternative to ear infections. How you decide to treat, those are all treatments, and how you decide to treat any condition, that's up to you. But what happens when we remove this interference in the neck or in the spine, we allow the brain and the body to function better, the way that it's supposed to. And that means that our bodies can heal the way that we're supposed to. And that just makes sense, that if our body is fully connected, that it can function the way that it's supposed to. And that's what a lot of our moms, our parents are finding out with chiropractic care, such that, if you compare the health status of children who primarily see chiropractors and primarily see medical doctors, you need both. We're not an alternative for medical doctors either. You absolutely need both. But what we find is that kids who routinely seek chiropractic care across the board, they need a whole heck of a lot less medical intervention. They get less tonsillitis, less ear infections. Their antibiotic use is way down. Even for other medications are way down. On this chart, they're also showing that vaccination rates are way down. But despite that, these kids are still healthy and they're not having as many health problems. So the question is, where do we go from here? Now, if you've tuned in this long and you've watched the whole thing, hopefully, you know that I've shared a lot of new ideas tonight. And I know there's a lot of people are thinking about things that have happened in your own life. Some of it makes sense. And there's two things that we could do right now. I could say, hey, it's been great. Hope you learned something. You guys take care. But I know something right now, that every single person who is watching this right now is wondering, could this really be why Johnny's having so much trouble? Is this why he keeps getting these ear infections? Could this be why? The doctors have never figured out, like, why is he having this going on all the time? Is this why his immune system is struggling so badly and out of balance? could this be why we've had so many challenges? Why I've slept at night, not really sure like what to do with him? Could this really truly be why? Could it be as simple as having a nerve system be interfered with and his body not being able to do what it should be doing right now, which is heal itself and express its full potential? And a lot of you are wondering, I know I came here for my son or my daughter, but could it be why I have migraines? Could it be why I have allergies? I mean, is it possible this subluxation thing could be why people that I care most about are living without their full potential? No, I could leave you wondering that, but I wouldn't sleep tonight, because I believe that each and every single person who sees this information, I believe everybody should see this information, but I believe you and your families, they at least deserve to find out if this is the reason that they're not living to their full potential. And if this is the reason why your child is suffering with ear infections, is because your nervous system has interference. So what I want to do tonight is I want to offer you an opportunity to come into our office. And what Dr. Abby and I will do is we're going to do a thorough history and consultation and a very thorough examination. We're going to do that exam that we just showed you previously. We're going to do that exam so that we're going to be able to sit down with you, and we're going to be able to say, yeah, this is what we found. We found a reason for your child to be experiencing this, or maybe we'll find out that he doesn't. And if he doesn't have a nerve interference, then we'll find the people that will help you. But if we do find that nerve interference, then we're going to tell you exactly what we need to do, how to correct it. Okay. We're include, exactly how many adjustments we need, how much money it'll cost, what those adjustments will look like. And what you decide to do once you have the information, that's completely up to you. But I really believe that you at least deserve the opportunity to find out, because we're here to help you help your family. So it's my pleasure being here tonight. I think you all deserve to find out what's going on, but I want you to know if this is something that you want to do to find out if your child has this interference. Just reply back to one of the emails, or if you're on our Facebook page, you can message us there. If you're in Illinois and you need Dr. Ballard, I'll make sure I get you over there, but she's sharing this through her Facebook page as well. So if you're, just message us and we will, we'll get you guys set up and taken care of, because we know at the end of the day, what we're doing isn't just helping kids with ear infections. We're really helping our children live life to a much greater, fuller potential than you can imagine. And so I want to thank you guys for tuning in. I know it's a late evening, but I hope you found this information valuable and that we can, help you guys help your children. Dr. Ballard, do you have anything you want to add in there?
I just got to get myself unmuted and flip this bad boy around. So, okay. So, Dr. Stephanie is absolutely right. We see these things walk into our office every single day. And we have parents that are saying, we've tried antibiotics, now we've had tubes, now we've done the antibiotic drops, they keep getting ear infections. We wish we'd never done the surgery. And what I find is very often we start that course of care. We do the history, we do the exam, we do the insight scan, and there it is, the big red bars right from that kiddo's neck, and it matches up perfectly with the history. So, like I say, these kids, your kids, they're our priority. This is our passion at our practices, is to help your kids to be able to live like Dr. Stephanie said, live life to their fullest potential. So we hope that if any of this resonated with you tonight, if you had that little light up above your head, if you heard something that really caught your attention, whether it's for you or your niece or your nephew or your coworker, please tag them in our videos. Let them get this information as well. Share it with your community. Help us to make ours the loudest voice out there. Because ultimately what we want to do is to grow healthier communities, one family at a time, and we can't do that without your support. So thank you guys all for attending tonight, and thank you again, Dr. Stephanie, for taking time away from your family to help me educate mine and the entirety of our community. And as Dr. Stephanie mentioned, 2 weeks from now, November 1st, I think it is. Is that correct?
Yes.
2 Wednesdays from now. So November 1st, we'll be doing another group webinar like this, and we'll be presenting what's called the perfect storm. So the perfect storm talks about that connection between the nervous system and neurodevelopmental problems. So these are things like behavioral issues, ADHD, and at the far end of that spectrum, autism. It talks about seizure disorders. So I'll have the privilege of presenting that information here in just a couple weeks, and Dr. Stephanie will be with us that day. So we hope that you all check out your emails, check out our Facebook pages, and join us on that webinar as well.